Number 4 is diabetes. Anyone tell me about diabetes? What's diabetes in a nutshell? One sentence.
It's a regulation of the sugar in the blood.
Yeah. So what happens to the regulation?
Well, if it's not regulated either, if it's too high or too low, then this is sorry, I'm
no, that's right. No, you're absolutely right. Well, too high. Too high is the point. Yes.
too high. Okay.
Yeah. So you're absolutely right. The diabetes is essentially where our sugars go high in the body. So I think in the South Asian community they call it sugar, don't they? They call it sugar.
Yeah.
So, but sugar actually means diabetes. And again, diabetes is related to a number of things. One is kind of being overweight, is poor diet, so too many sugary foods and drinks. I met a guy who was his sugars were sky high. He was like a bodybuilder, and he was drinking Lucozade after every kind of workout. But actually, just by changing his diet, his sugars came back to normal. Don't know how he did it, but he must have. There's also a genetic element, and unfortunately, I have to tell you now, breaking news to you, unfortunately for South Asians, diabetes is much more common. So I would make sure that we get our weight right, we get our diet right, because unfortunately it is more common within kind of the South Asian community. So diabetes is related to being overweight, poor diet, lack of exercise, and the genetic element as well. Now, diabetes, it can cause a number of complications, and this is why there's so much emphasis on monitoring and so forth. It can affect our eyes, it can affect our circulation, so this itself is a risk factor for heart disease and stroke. It can also affect our kidneys, and as well as causing things like fatigue, dry mouth, and infection. So these are the complications of diabetes. But having said all that, I'll say this, and I'll be very clear with you now. I have a patient who's been diabetic since the age of about 11. And now he's 70-something, and he's doing fine. Now, this person, he's been diabetic on insulin from that young age. But because he's looked after himself, because he's kept an eye on his sugars, he's controlled them well, he's maintained his weight, he's 60 years plus later, he's doing fine. He's doing really okay, and hopefully he'll keep on doing very well. So, with diabetes, yes, there are complications, but at the same time, inshallah, if we try our best to look after our health as much as we can, it's not always possible, but we try our best as much as we can also control and reduce all these risks of complications. But it takes a lot of effort, a lot of work as well. But inshallah, we can reduce the complications. So how do we treat diabetes? Number 1 is all about prevention, isn't it? So there's a common theme here. We're talking about prevention a lot of the time. And as Councillor McGee said before, that this is a key thing that we need to be doing. And part of these presentations is about empowering ourselves to look after our health. So we need to look after our weight, we need to exercise, we need to eat properly, look after your diet, less sugar. And if you can do lots of these things, then we can control and prevent lots of these conditions. So diabetes, main thing is exercising, eating less sugar, losing weight. Lifestyle is the big thing. There's medications, a variety of tablets and medicines out there now, and insulin is obviously, everyone's heard of the needle that we use for controlling diabetes. Actually, the needle's not that bad. I know no one really wants to inject themselves, I can appreciate that. But, it's not a huge needle, it's a tiny, very thin needle, and I know that the majority of people that are using insulin to control their diabetes, they very easily get used to it. So I know there's a bit of a fear. I was going to bring some needles today and inject myself, but I didn't get a chance to. But maybe next time perhaps I'll inject myself and see it's actually not that bad. So, key thing, regular monitoring for diabetes. Okay, up to number 5, we're almost there, halfway through.